Hi, my name is Michael Baracy Jr. I am a PGY3 at Ascension St. John Hospital, Department of Obstetrics and Gynecology, and I'll be presenting Coronavirus Disease 2019 and the Risk of Hypertensive Disorders of Pregnancy, a retrospective cohort study. To give a little background, there were a small number of cases of COVID-19 in pregnancy across several Ascension, Michigan hospitals in March of 2020. Approximately 30% of these patients developed a hypertensive disorder of pregnancy, namely preeclampsia or preeclampsia with severe features. This incidence was much higher than the 6 to 11% baseline incidence typically quoted in pregnancy. This is important because we know that patients diagnosed with a hypertensive disorder of pregnancy are at an increased risk of an iatrogenic preterm birth because these patients wind up getting induced early. Thus, if COVID increased the risk of hypertensive disorders of pregnancy, we would expect to see an increase in iatrogenic preterm deliveries. Early reports of COVID-19 in pregnancy suggested that there might be an association of SARS-CoV-2 infection and hypertensive disorders in pregnancy. However, this suspected association was mainly based on case reports and systematic reviews that incorporated multiple coronavirus species, namely SARS-CoV and MERS-CoV. The few studies that did test the association between COVID-19 and hypertensive disorders of pregnancy lacked a comparator group, were underpowered, or were based on composite indices, limiting the interpretation of their results. So we set out to determine if there was in fact an association between SARS-CoV-2 and hypertensive disorders of pregnancy. This was a historical cohort study that compared index deliveries or pregnancies affected by COVID-19 to 3 subsequent deliveries that did not have COVID-19 during their pregnancy. It included 4 community hospitals in the Metro Detroit area, and data was collected between February 1st, 2020 and November 24th, 2020. Undelivered patients were excluded, and to detect a statistical difference, we calculated that we needed 360 participants based on a 6.5% risk of hypertensive disorders in pregnancies unaffected by COVID-19 and a 16.5% risk of hypertensive disorder in pregnancies affected by COVID-19. Since 3 controls were matched to every case, we needed 270 controls and 90 cases, and this was calculated based on an 80% power and an alpha error rate of 0.05. Univariable analyses were conducted with a student's t-test, chi-squared analysis, or ANOVA. Logistic regression was used for multivariable analyses. All variables associated with a hypertensive disorder of pregnancy diagnosis or COVID-19 with a p-value of less than 0.1 was entered into the multivariable logistic regression with a forward likelihood ratio algorithm. The model with the lowest -2 log likelihood value was taken to be the best model for the data, and a p-value of less than 0.05 was taken to indicate statistical significance. There were 5,962 deliveries during the study period. Of those, 70 patients tested positive for COVID-19 during their pregnancy, and they were matched to the 3 subsequent deliveries for a total of 280 deliveries analyzed. Of the 70 patients with a diagnosis of COVID-19 during their pregnancy, 22 went on to develop a hypertensive disorder of pregnancy. Of the 210 negative controls, 28 went on to develop a hypertensive disorder of pregnancy. Black patients were more likely to have a diagnosis of COVID during their pregnancy, and those that used recreational drugs were also more likely to have a diagnosis of COVID during their pregnancy. Those with a COVID diagnosis during their pregnancy were more likely to deliver at an earlier gestational age. We conducted a chi-square analysis for our primary outcome and found that approximately 31% of patients with a COVID-19 diagnosis during their pregnancy also had a hypertensive disorder of pregnancy diagnosis, while only 13% of those patients without a COVID-19 diagnosis during their pregnancy had a hypertensive disorder of pregnancy. And this was statistically significant with a p-value of 0.01. To evaluate for confounding, we conducted a logistic regression analysis and found that patients with COVID-19 in their pregnancy were approximately 3.7 times more likely to develop a hypertensive disorder of pregnancy compared to those that tested negative, even after controlling for other predictors. When we look at it graphically on a forest plot, we see that chronic hypertension and preeclampsia in a previous pregnancy were the strongest predictors of a hypertensive disorder of pregnancy in the current pregnancy. However, COVID-19 was the 3rd strongest predictor. When we look at all patients, we see that patients diagnosed with COVID-19 had a higher risk of gestational hypertension, preeclampsia, and preeclampsia with severe features. When we stratified the patients with a COVID-19 diagnosis by symptomatology, we found that the majority of patients with a concomitant diagnosis of a hypertensive disorder of pregnancy were asymptomatic from a COVID standpoint. We also stratified patients by early versus late COVID-19 diagnoses. We defined early COVID-19 diagnosis as prior to 32 weeks gestation and late COVID-19 diagnosis as 32 weeks or after. We found that those with early COVID-19 were 13 times more likely to be diagnosed with a hypertensive disorder of pregnancy, and those with late COVID were only 1.9 times more likely, and this was not statistically significant. When we compared early versus late COVID diagnosis in pregnancy, we found that those with early COVID diagnoses were approximately 7 times more likely to have a diagnosis of a hypertensive disorder of pregnancy. So ultimately, we concluded that pregnant patients with a history of COVID-19 disease in their pregnancy are at an increased risk of developing a hypertensive disorder of pregnancy, regardless of their symptomatology. COVID-19 in early pregnancy confers a higher risk for development of a hypertensive disorder of pregnancy. COVID-19 increases the risk of iatrogenic preterm birth, and this is secondary to hypertensive disorders. So ultimately, we need to develop strategies to mitigate iatrogenic complications related to COVID-19 and hypertensive disorders in pregnancy. I hope you enjoyed this presentation. Thank you.